everybody. I'm Michael Munson with Forge, and we are really lucky to have two folks from the medical college with us tonight. So Dr. Andy Petrol and Ann Brooks, who's a nurse in the infectious disease department. Is that correct? Correct, right? Okay. I'm going to have this down by the time we're done with this. We have a great ASL interpreter, so a new face for some folks. But we're really excited that you're here, and my job tonight is just to kind of play host and kind of convey the questions to our two expert panel people today. I'm wanting just to make sure that we do a couple of housekeeping items. So one is we would like to thank our funder who is making some of this work possible of 5 events a week, which is a lot of stuff that's happening for folks to connect and learn new things and feel a little bit more supported during these tough times. So we are really grateful to the Advancing a Healthier Wisconsin endowment at the Medical College of Wisconsin. And it's made our partnership between Forge and the Medical College of Wisconsin's Inclusion Clinic even stronger than it was before, and we're having a great time really exploring some of that work together as two entities, organizations. Tonight we're going to talk about kind of the emergence of staying safe and what happens if we're an essential worker, or even if we aren't an essential worker, but we're moving back into that workplace. And I would love it if Dr. Petrol and Ann, if you would mind introducing yourselves better than I can introduce you, and we'll get started tonight.
Sure, great, thanks, Michael. So I'm Andy Petrol. I am a associate professor at the Medical College of Wisconsin, and I have training in infectious diseases, and I also am the medical director of the Inclusion Health Clinic at Frederick and MCW, which is a clinic designed specifically to serve the needs of LGBTQ people. Ann.
I'm Ann Brooks. I am a nurse in the infectious disease department and the inclusion clinic at Frederick with Dr. Petrol. I started there in January. The other clinic I work in is a primary care clinic with Frederick out in Brookfield.
Great, thank you. So Dr. Petrol, do you want to start us in a direction, or do you want to start
with a direction, Michael? We do. So, I think we face these kind of questions frequently about people wondering what they should do in a workplace setting if they are already kind of been working the whole time. We've had questions from our patients and other people that we know who ask us that. And then there'll be a lot more people who maybe were not working in the last couple months who may be returning to work. So Ann and I tried to put together some tips for commonly asked questions and things to think about as a starting point. And then after about probably 5 to 10 minutes, we'll stop and see if there's questions. And if people are shy or there aren't a lot of questions, we do have a few scenarios we could get into about more specific details. So I'm gonna kind of kick it off here with some general tips. So when I think about like going to work, the first thing of course is getting to work. And so there's lots of different ways people get to work. As we already probably know from our previous discussions and what's out there in the world for information, being outside is one of the safest places to be. So if it's possible for people to walk or bike or, I don't know, take a motorcycle or whatever else they would like to work, those are really safe ways to get there. Probably the least, I won't say the least safe way, but the way that may have the most likely chance of interacting with people or somebody who may have COVID is public transportation. And so I know that that's a way that many people do get to work and depend on that. But in these times, if people want to know ways to minimize the risk, avoiding buses in the case of where we live is one way to reduce the risk if that's possible. So of course, going out and then being at work, our recommendations are similar to what you've heard in other places, which are wearing a face mask is helpful, and what's helpful to you is if all of your coworkers are also wearing them. And of course, washing your hands whenever that's available to you, especially if you're handling things from the public, like people, like customers in a store or something like that. they're handing you credit cards or money or anything else, if you're able to wash your hands in between interactions, that would be a way to reduce your risk. Of course, keeping distance between yourself and other coworkers, as well as members of the public, as much as possible. Of course, these depend a lot on the kind of work you're doing and the physical layout of the place where you're going to work. Just also a reminder that alcohol sanitizer, if it's more than 60%, which pretty much all of the hand sanitizer brands are, is a fine alternative to washing your hands, because not everyone has a sink around where they are at work. Also think about when and how you can wash surfaces. So if you're working at a store and people kind of come to the counter and they set things down, if you're able to like wipe the area in between customers, and especially before you touch the area, that would be advisable. Most importantly, though, is no matter what you're doing, try to, of course, not to touch your face while you're at work and interacting with surfaces and people. So sometimes people ask about gloves. Gloves are not particularly recommended for this particular infectious disease, because it spreads mostly through the air. And as I just mentioned, sometimes through contaminated surfaces. The thing about gloves is that unless you're used to wearing gloves, sometimes people don't interact with the gloves in a way that's very protective. So taking them on and off and making sure to wash your hands after is useful if you're going to wear them, but generally they're not particularly recommended. I think they can give people kind of a false sense of security, that they're protecting themselves from the environment. And then my last tip in this first section is in the environment, try to, as I mentioned before, keep space between you and other people, but in effect, maybe that means that you go on break at a different time than your coworkers, or if there's a break room, maybe you don't go there, and if it's possible to go outside and it's not a terrible day like some of the days this week, and there's space for you to be outside, that could be a better place to take your break or lunch or whatever. So I'm going to pass it over to Anne, who is going to talk a little bit about other things about the work environment itself.
Yes, so I'm going to try hard to cover some topics here about the work environment. So people who have been going out recently, you'll notice that a lot of stores are putting in place plexiglass dividers maybe between your customer and yourself, if you're at a checkout or at a counter. So just making sure you're using that, and that your customers are using that. You can definitely make sure you're using your masks at work, not just to and from work, but at work. I gotta get my list, excuse me. Andy, can you think of anything else on that list?
Sorry.
Sorry.
So if it's possible at your workplace, and again, this is real variable, but if it's possible to open a door, if a front door to a business that can stay open if the weather's half decent, the more air that will diffuse the droplets that come out of your customers, the better. So if it's possible to let air through the building that way, that would be great. If you have any control over the environment or can make recommendations to your kind of whoever is running the place to use no touch things like trash cans that you can open with your foot, or soap dispensers where you hold your hand under instead of actually pressing down on the thing, and things like that. Those are pretty common recommendations. When we were brainstorming, having read a lot of articles about interesting places that COVID has been transmitted, it made me think about one in particular, which is, and there's no proof of this, of course, because no one has looked at it, but if there's a way to make the environment quieter, meaning if your business usually plays music or something, whatever seems to make people talk louder seems more likely to transmit this virus. We know that there have been really strong associations between transmission and things like choir practice, where people are obviously singing and projecting, and other people are taking deep breaths. So whatever you can do to like minimize the volume of people like exhaling in your space, could be helpful. Did you want to add any more to this section, Anne?
Yeah, we were on our list of brainstorming ideas was ventilation flow. So I know like in our clinics at Freighter, they've increased the air circulations in the clinics. So that again, just to kind of help refresh the air, if there's any lingering germs or droplets, and that's getting taken care of. If you can talk to a person at your work about things like that to help reduce your risk, you can do that.
Yeah. I had a few. Are we good on this section, Anne?
I think so, yeah.
I had a few things about other like logistic aspects of work. If you have control, or if you get in on discussions with other people at work, minimizing the number of people at work at the same time. So if some people can work like kind of alternate shifts, or obviously from home, but if people can stagger their work, when it's possible, to avoid sharing equipment like phones, which of course is maybe hard to control, because if you go into a place and there's like one phone that you're supposed to answer, that makes it kind of tough. But if you can, especially if you're stationed at like a phone, a cash register, or whatever for a while, and you can go into work and wipe that clean with sanitizing cloth or whatever you have available before you start, that would be of course helpful. Avoiding meetings, in-person meetings, would be great if your workplace can arrange that. And hopefully encouraging your workplace to continue doing curbside delivery or carrying items out, whatever kind of workplace it is, to people, rather than having more people come inside the store. In some cases, it's possible to change the layout of the store. So people are maybe going only in one direction, up an aisle and down the next aisle, and not going all the different ways. And of course, setting some space at, like, if there's a checkout, putting like an extra table in front of the usual counter, so people are farther away from you if you're behind the counter. And then like keeping people informed of what you've done is useful. If that's like on social media before people come to your place of work, or like an infographic or something on the front door before people enter your place, to kind of give people a clue to how to follow the things that you've set up to minimize exposures.
And on that too, just reminding people, like when you are at work, because I know a lot of stores now, they have like X's on the floor, like in the checkout lane, like when you're supposed to line up, and it gives you kind of that 6 space in between customers. And some people, like I've done it, I've gone to the store and I totally forget about it because you're just not used to it. We're living in a whole different world now. So just reminding people, hey, can you please step to the next X and just wait your turn? Just because we're all learning, it's all in the learning curve.
Yeah, so I think that was about the bulk of our main general recommendations, unless you have any to add, Anne.
I don't think I do. We can see if there's any questions, and we can kind of go from there.
Why don't we pause now and see? I see one question so far, but if you have another question, now is a fine time to type that in while we address this question.
Do you want to read it, or you want me to read it?
Oh, I like it when you read the questions.
That's special. So the one question that's there, and people can be thinking about what else they want to ask while we're doing this question, is the question is, I've heard of some places that don't allow employees to bring their own masks and don't have enough masks to go around, and at least one that doesn't allow masks at all. What are those in that situation supposed to do? A really good question.
Yeah, so if it's just a matter of not having enough masks to give to employees, there are certainly a lot of places to get masks, and I don't know if Michael, you want to chime in right here?
Sure. Forge has a bunch of masks. We are restocking our bunches of masks. So we have masks that we can send people.
Yeah, they're available in different parts of like the city and state through different organizations. So if that's the limiting factor, hopefully, each person can look for places to get masks that are in many cases available for free. If you like to sew, there's lots of patterns online. But anyway, that's certainly not something I could do. If the business place is kind of not permitting employees to wear masks, then I think that's a different question. Then I think you would have to consider if that's a place you want to keep working, depending on the circumstance, right? If this is working in an office where you have like a cubicle with space around you, then the risk is probably pretty low. If you're working at like a store where there's people coming up, especially if there's no like plexiglass divider that's been put up, you know, that's starting to get into at least moderate risk. And any of the, what we would consider kind of high risk professions certainly should have all of these things in place. Like if you're working in a hospital or a medical setting, they should have all of the things necessary. So I think it's important to weigh the risk and think about, you know, what you think your personal risk for a complication might be and how much you like that job before you decide if you want to keep doing it if you're not going to be allowed to wear a mask.
You know, that kind of taps into a question that we were talking about at the last Ask session, which is recorded and available for people to look at. But one of them, the question that comes to mind is kind of a tangent of that, of like, what if people have certain masks that they would prefer to wear because it expresses their gender more fully? So, you know, they like masks that have certain colors or certain designs on it because it helps project their gender. So I guess I'm wondering, you know, like kind of what the recommendation or what the guidance might be of like maybe self-advocacy of like, you know, hey, I want to bring my own mask in. And some companies might say, no, you have to wear our plain blue, you know, dorky looking ones or something. Do you think people can advocate?
I think that, so if we want to look at the science, so the science behind these cloth masks, like non-medical masks, which is mainly what we're talking about here, is that they're somewhat protective. They're actually most helpful for preventing like your oral and nasal secretions going out into the world and getting on other people. So the differences between like the masks that like someone might make or they might buy, or there's tons of different kinds that are for sale, I think the differences are very minimal. So there certainly isn't like a scientific reason why an employer should forbid a person from wearing whichever type of mask that they might want to wear. Whether they just want to project some, you know, like almost like a uniform, I guess that's a different kind of question. And certainly I would hope that an employer would be open to listening to a person who had a specific reason that they wanted to have an appearance that was, you know, important to them. But that gets into, I guess, employee relation type things, which I'm not fully qualified to talk about.
Right. I think that's a really hard, you know, that's a subjective question about where somebody works and how comfortable they are with their boss or whatever else. Should we move to the next question?
Sure.
Sure. So the next question is, what suggestions do you have for staying safe when we do have to take public transportation?
Sure. Well, I think so. Obviously, like staying as far away from people as possible, which is, I think, how it's going now, with only allowing 10 people on a bus at a time, at least here, which can make maybe your trip slower if you have to get somewhere and you can't get on the bus you were hoping to. But, you know, obviously, like sitting as far away from other people as possible. I think the bus is a great example of, like, you're pretty much forced to touch things when you get in the bus with your hand. I mean, obviously you're going to sit, but sitting on a seat doesn't really put you at very much risk. But obviously you have to hold on to the bar, especially if they start driving while you're still getting to your seat and all that. This would be a time to particularly be cautious to not touch your face or use your own hand sanitizer you bring with you after you get seated. You know, clean your hands so that if you happen to, you know, do the normal thing of touching your face occasionally, your hands have been clean since then. I think it's obvious, like, you'll want to wear your own mask and hope that people around you do. I mean, if things get really, if people get back to work more and they don't continue the current routine that they have, restrictions on the buses, and they get more crowded, at some point you may want to weigh, like, that bus looks really crowded. I don't know if I want to get on that one. So I think those are my general suggestions. I don't know, Anne, do you want to add anything that I missed?
No, I just think for sure, just hand sanitizer and just making sure you're keeping your hands clean is probably the best thing that you can do.
So it sounds like people may want to like leave earlier for work. So if they don't want to get on that really crowded bus, they can still get to work on time and take the next bus.
Mm-hmm.
And then all those other precautions.
In some ways, the bus is not like the worst place for aerosol transmission, in that like everyone's facing like the same way. So if someone's coughing on you, it's gonna hit the back of your head, which won't really get you sick, unless you happen to. A whole bunch of events may happen and they get in your face. But that's nice, as opposed to other settings like where people are facing each other, like a counter at a store or something.
Can you all talk a little bit about ride shares? Because that's not exactly public transportation, but it's close to public transportation.
Yeah. So I think that that's an interesting alternative. Obviously, when you compare the risks, it's probably a lot lower, in that you're in a car with one person, usually, unless you're doing one of the multiple shares. So that it is going to be a lot lower risk than being in a place with a lot more people. The space is smaller. So if that one person happens to be sick, you're awfully close to the person. Although again, like, they're mainly talking the other way. And hopefully, I'm not positive if the rideshare companies have made policies on drivers wearing masks, but I kind of would hope so. And if your driver doesn't, maybe that's one to skip. So generally, that's my feeling. Same thing goes though with the surfaces. You want to make sure that you keep your hands clean after you touch like the door handle, seatbelt, or whatever you're doing.
That's great. I do think that I heard something about Uber requiring all their drivers to wear masks and all their passengers to wear masks. I could be wrong about that, but yeah, I think you have to send, if you're a rider, a picture of yourself or have it in your profile that you have a mask on. And I could be wrong about that, but I think that they're doing that at least in some of the larger cities, if nothing else. Let's do the next question, which is now that suburban businesses are allowed to open on Friday in Milwaukee area, do you have a sense of what protections, if any, people have if they're not comfortable going in right now because of exposure, especially in non-essential businesses?
So I think that question veers a little bit outside of my own expertise, but it's a great question. And it's one that we actually hear. I have had several or many patients ask me this question. So I think that there's somebody on the panel who could do a little bit better job at answering that than I can. So
Shelley,
hand it off.
Shelley Gregory is on Forge's staff and can probably take some kind of answer on this.
Yeah, thank you, Michael and Andy, and happy to jump in here for a moment. So there are some protections for workers, and we have some laws that have created some additional protections, and some laws that have created some additional benefits for folks who can't be at work for some very particular reasons. Unfortunately, there's one kind of big hole in all of those protections, and that is protection around essentially our own concerns about exposure. If we don't have some kind of underlying medical condition or disability that would qualify for protection in the workplace. So somebody who is not at heightened risk for acquiring COVID-19, unfortunately doesn't have any legal protection and is in the most difficult position of all of having to make that choice that Dr. Petrol mentioned earlier, between unfortunately deciding between whether to go back to work or not. Folks are not eligible for unemployment insurance if they don't want to go back to work because of concern about exposure. Now, if somebody has a diagnosis, if they're caring for someone with a diagnosis, or if they're caring for a kid because schools are closed and childcare is not available, There are some protections for folks to stay out of work and to have some wage replacement. But this, unfortunately, is a really big gap that people are going to have to figure out how to negotiate themselves. And what I would really recommend is thinking about your own health situation, and whether, if you do have any chronic, medical conditions that you seek treatment for, maybe discussing those with your medical provider, and talking to them about whether they might be able to help you out, and provide you, some written documentation, or a recommendation that, you not go back to work because of an underlying condition. And that's the best bet that folks are going to have, both for staying out of work and for qualifying for wage replacement benefits.
Yeah, and I would add that that is something that has happened commonly, like providing those kinds of letters. I guess like maybe we should also at the same time address, I guess, the opposite side of that issue. So if you happen to be a person who doesn't kind of medically qualify to be excused from work, and have the protections that Shelley mentioned, and I don't have a particular opinion on this, but I think it's fair to like think about the risks and benefits. So I think, obviously there's a lot of unemployment, so finding a job is not easy right now. So if you happen to be a person who doesn't have any underlying conditions that would put you at higher risk for complications from COVID, or you're not in the age range itself, older ages where complications are more likely, the actual risk of a serious complication from COVID is not, high. It's probably in the we don't know these answers for sure yet, but it's in the single-digit %. So I think when it comes to weighing, your risks and benefit, if it means that you would be out of work without some of the benefits and protections that were mentioned, the actual risk may be low if you don't fit those categories. So I think it's important to consider that if you're considering like your overall financial well-being and housing and things like that, versus going to work. So I think it's important to have a sense of what the balance is there if you're going to make that kind of decision. And that's something that if you have a healthcare provider, you can ask them about that, if you don't want to ask right now, or if you're watching this later.
And I would just underscore what Andy just said and say, the other thing to do really is to talk to your employer. Employers, very often are happy to work with employees. So, and to help, employers have a duty to keep all of their employees, provide a safe and a healthful work environment for employees. It is not acceptable for employers to put people in hazardous working conditions. And so, there's some onus on our employers, I think, to work with us around some of these scenarios. And I really recommend, talk to your healthcare provider, like Andy said, and then have your next stop be your employer. And maybe the conversation is, look, I don't feel comfortable coming back, and here's why. I have a parent who is immune compromised that I care for. Or, I think the exposure risk is too high right now, but in 2 weeks, I think I'm going to feel better. Could I come back in 2 weeks and stay on my unemployment, rather than losing my job? So those are, there are a number of conversations folks can have with their employers as well, and try to think creatively about some solutions here.
And this is Michael. I just wanted to step in too and say that, folks that might be wondering about how to have those conversations, Shelley, I'm going to volunteer you because it's part of your job is that folks can call Forge, and Shelley is going to be the person that likely will respond to you and help you think through what some of those options are about how you can advocate for yourself in those work environments so that you can keep your job and stay as safe as possible and come up with some creative strategies. Thank you, Shelley. So I haven't seen any more questions come in. I want to just make sure that we have a space for folks to continue to ask questions. All the questions so far have been really excellent. So just a reminder that folks can raise your hand and we'll unmute you, or you can type in a question in the chat box.
Sure. Yeah, I'd be glad to address that. So I think the tough part about understanding something like an epidemic and the effect of public health measures, which is kind of the stay-at-home stuff that we've been doing for the last 2 months or so, is that the success of them means that more people don't get sick. So if we did not do this, we know that a lot more people would have gotten sick and died. And you can measure that in a lot of different ways by comparing, say, states that did start doing this earlier versus that didn't, or you can look at what happened in different countries. But certainly there's lots of statistics on the number of people who have died in the last 2 months from this. We're approaching 100,000 people in the United States. As well as the fact that like many people fit into the categories we talked about, which are people who had some underlying diseases, lung or heart disease or other conditions, and people who are older. But also, it doesn't always follow those rules. So I was recently working in the hospital, and during the week that I was doing that service, a 26-year-old patient died from COVID. So it is a real thing that affects people both who do fit some of the criteria we think about and some who don't. And we don't understand a lot about this particular virus because it's really only been known for about 6 months. There's another new phenomenon that's been described now in a number of children who get kind of an unusual neurologic disorder from COVID, and so that's something we're just starting to understand. So it was previously thought that really it was older adults who were at risk, but now from complications especially. But now it looks like there's this other neurologic phenomenon that can happen to kids, which can be pretty significant, and we don't really even understand how many will end up getting it and what the long-term outcomes for those kids will be. So yeah, this is about the biggest public health thing that's happened in the last 100 years. So yeah, it is something that can impact our society depending on how we deal with it. I mean, it already has impacted our society significantly, but we'll only know over time what our actions will lead us to. So I think a cautious approach is wise based on what we know so far.
Based on what you just said about, now children are being affected, or we're noticing that children are being affected. Is the guess that the virus is mutating and it might, change and affect other populations more? Or is that something that's not, I mean, obviously it's a new virus, so we don't know what's probably going to happen.
Yeah, there are now descriptions of some changes in the virus. It seems like there's two main strains that have affected the US so far. One is kind of the strain that came over from Europe, and that's the one that kind of started on the East Coast and is actually the one that it seems to be predominant here. As far as we know, there's a lot more work to be done. And then there's the other kind of main strain that seems to have come directly from Asia that started in Seattle and on the West Coast. And people are starting to describe some differences. And the thing is that, some of these side effects, like especially maybe severe things that happen to children, we won't know until they happen to, maybe it's 1 in 1,000 kids gets a horrible neurologic problem. So until you have thousands of kids who are getting COVID, you won't know that this horrible thing is going to happen to 0.1% of them. So there's a lot to learn, and the virus may continue to evolve. There may be things about differences in what we call the host, meaning different people have things that are different about them, whether that has to do with genetics and ethnic background in different parts of the world. These are things that we're still just figuring out. So there is the potential for new things. We certainly don't know everything about what this virus can do yet.
Let's go to another question. So question is, Dr. Petrol mentioned that aerosol transmission appears more common than transmission via contact with a surface. Given that cloth masks are intended to protect others, not the wearer, are there types of employees that you'd recommend seeking or using masks designed to limit aerosol transmission, so surgical or N95.
Yeah. So right. So you're right on that the cloth masks really are mainly to prevent a person's secretions from going out into the world and getting onto other people, and not necessarily to protect the person themselves. And so places where transmission likelihood is high include things like medical, dental offices. I would add on that other places where people in close contact, like salons and spas and things like that, getting haircuts or nails or whatever. I would say that people, including employees of all the, in healthcare settings, those employees should have surgical grade masks, medical grade masks to wear. In other settings that, you know, hadn't been the standard so far, when you go to your hairstylist, they would not necessarily be wearing a surgical mask to protect themselves. But if they're available, that is probably a good idea for people who have prolonged and close exposure to other people. It's just that they're not easy to find. So they're becoming easier to find as kind of production is caught up with some of the demand.
A related question to that, I've seen masks that are like, I think they're called K95 instead of N95s. Do those offer additional protection, like above and beyond a cloth mask?
Supposedly, those are kind of similar to N95 masks, but not quite the same. And to be honest, I shouldn't comment on the difference because I don't actually know the difference between the two. I think it's important to note that for most people, a plain surgical mask, which is like kind of a healthcare grade mask that looks kind of like a cloth mask, but it's not. You can tell it's made out of kind of a papery substance. I'm not sure exactly what it is. That is totally fine for people doing almost anything. In the hospital, the only people who are wearing N95 masks are people who are literally putting the tube down into someone's lungs or giving breathing treatments where people are coughing up secretions that are what we call aerosolized. So most people wouldn't need, doing most jobs, wouldn't need an N95 mask. And if you've never tried one, they're very uncomfortable to keep on for very long anyway. So in those occupations that I just mentioned, a regular surgical mask should be totally fine to wear.
Great. Let's look at another question. So person that asks, right when the lockdown started, I had major issues with my voice for 2 weeks. Could it have had anything to do with COVID-19?
So that's a great question. And that is a question that's asked a lot. So it's hard to answer the question because we don't really know. Certainly, this winter through, January through March and so on, there were plenty of respiratory viruses going around, most of which were not COVID, and can cause some of those symptoms. The symptoms from COVID can be kind of broad, but there are a few like signature symptoms that are common to most people with COVID, and not everybody, because some people barely know that they have it. But when people get the symptoms, there are things like fever is very kind of prominent, body aches, cough, and shortness of breath. So those are very indicative of what may be COVID disease. Having a sore throat alone or like a voice problem alone, it's hard to say. So until recently, I would have recommended that you I wouldn't have recommended anything in particular because there wasn't any testing available. Certainly the test for COVID, the viral test where you get the swab put in your nose to collect a sample and send to look for a virus, that wouldn't be useful to you now because that's only positive for probably about 7 to 14 days after someone were to have come in contact with COVID themselves. So that would be long gone by now for you. Now there are coming in online some, not online, but in a manner of speaking, there are becoming available some blood tests for measuring antibodies to COVID-19. And it's certainly wouldn't change anything medically for you to get one of those tests. You would just be satisfying, might be satisfying to know. So perhaps the next time you were somewhere in a medical facility and you could ask a provider for one, you might. They may or may not think that it's a good idea to order it based on the circumstances, but that's becoming available. They've become available locally in the last couple weeks.
Cool. There's 2 more questions that are in the chat. So the first one is, if someone contracted and recovered from COVID and is back, going back to work, you recommend that they continue to follow the CDC guidelines?
Yeah. So the answer, kind of the party line answer is yes, because we haven't quite proven yet, because this virus has only been around a relatively short period of time. We haven't proven that if you go through it once that you couldn't get it again. However, it's likely that a person would be protected at least for some period of time, whether that's some number of months. We certainly don't know if it protects you for years after this episode, but in the next couple to few months, it probably is protective. However, I think it's important that everyone kind of keep playing by the same rules. So it would be, I think, pretty disastrous if people say like, oh, I had COVID, so I don't have to wear this mask anymore because I'm done, I'm over that. So I think that would kind of create a lot of difficulties generally. But I would say that the person themselves can probably feel somewhat reassured that in the short term, that's not something they likely have to worry about again.
And could you just explain, so this person is asking, to follow the CDC guidelines. What are the CDC guidelines in a paragraph form or a bullet form?
The CDC guidelines are basically to try to maximize the space between you and other people, and 6 feet is recommended. Wearing a cloth mask whenever you're going to be around people. Washing your hands whenever you can when you are out in public spaces, and trying to not touch your face. I might also add to try to get sufficient rest, because other things that affect our immune system, rest and eating well and trying to reduce stress, which we've talked about in other sessions, can contribute to the strength of our immune system.
Excellent. And I've realized how many times I've touched my face just in this last 45 minutes, right? So it's really hard to not do some of those things when we're just interacting in the world. So another question in the chat box is, do you have any recommendations to help workers protect their families when they come home from work?
Yeah, so that's a good question that we get. And we probably, Anne and I probably think about this a lot when we come home from work, because we're around people who actually who have COVID for sure. But basically, if it's possible to wash your hands after you're right upon entry to the house, and then I would suggest taking a shower after you get home, just because of the possibility of having things on other parts of your body or on your face that are, maybe on your forehead. Maybe you were had your mask or you had your glasses on and there's stuff on your forehead that you're going to then touch and get in your mouth or your nose yourself. So taking a shower after work, and then taking your clothes and just neatly putting them into the laundry, and not wearing them around the house, and maybe defer on the hugs and stuff until after your shower and your hand washing and stuff is probably a good idea. Anne, do you want to add something to that? I feel like you're nodding.
Yeah, no, I know, with speaking with my sister-in-law recently, she works in a dental office, again, a high risk for aerosols. And we were kind of discussing the same thing, well, how is she going to protect her kids coming home? And she had decided that she's going to change her clothes before she even leaves. So she will change her clothes at her end of her shift, wash her hands, change her clothes, and then come home. And it just kind of reduces one more layer for when you get home. Otherwise, sometimes people, there's nurses who are or medical assistants or CNAs who are, unclothing in their garage, if that's possible, if you have a garage that you can do that in. And then, just kind of like wrapping up in a towel and getting right in the shower. Taking off your shoes, making sure your shoes stay out of your house, because those are definitely, they can track germs, and we just don't even think about it sometimes when we're coming into the house. And just washing your hands.
Those are all great answers and great questions. We have time probably for another one or two questions. So the next question in line is, are there individuals for whom wearing a mask is not functionally possible or medically recommended? And I'd like to add maybe a little add to that, because we've heard from some folks who have asthma who find it really difficult to breathe through a mask. And we also know that the really high percentage of trans folks are on the autism spectrum in some way. And so finding literally anything on their face is just really, really emotionally uncomfortable. So both, I would be curious about both the medically as well as some of the more emotional or cognitive reasons.
Sure, I can start, and I know Anne has some ideas on this too. It's interesting because people who have breathing difficulties, in general, are the ones who we want to protect the most from this. And the more protective the mask, if we start with the N95 mask, is the one that's the most protective. It's the hardest one to breathe through. And as you step down to like a regular medical mask and then a cloth mask, they get easier to breathe through, but they're also less protective from the virus. So there's a bit of irony there. So it is possible that people can't wear them, or even if people have other like claustrophobia or other things that prevents them, that I would argue that that's what makes it important that everybody wear masks who can wear them, and that kind of protects people generally as much as possible. And you want to talk about the sensation issue?
Yeah, I definitely think finding a mask or material that you like, there's so many different types of cloth out there, something that might be more comfortable on your skin and that you can handle for a little bit longer periods of time. And then just doing practice sessions and wearing it maybe for like a minute or two, and doing that several times throughout the day and trying to increase your time, especially if you have to wear a mask when you go back to work. And then that way you can kind of ease into it instead of just wearing a mask for 4 hours or 6 hours. And definitely for breathing through some of those cloth masks too, I'm really trying to find one, because I've gotten some at work and they're like double layered and they're a little harder to breathe through too than like a single layered cloth mask. So finding one that works, that is comfortable for you, and then just wearing it as much as you can for as long as you can. Practice wearing it.
Yeah, the practicing is an interesting idea, right? Because if you have a mask that's more protective, it does kind of change your breathing pattern a little bit. I think we're more likely to take slower and longer breaths when we have the mask on than like kind of the shorter and more shallow breaths than when we're breathing freely. So just getting used to that and trying it out for a while is a really, really great idea.
Those are great suggestions, and I think especially as we're moving into the summer and the warmer, so like paying attention to, are they double, are they single, how thick are they, and what can I breathe better through? All of that kind of contributes to more compliance with mask wearing. That's great. Can we do one more question before we wrap up? So the last question that I'm seeing here is, how long can the virus live on textiles like clothes?
Yeah, so there's been some work done on this. Interestingly, clothes is not one of the things that was studied, but let me go through it and I'll give kind of an answer at the end. So what they found was that this virus can live on hard surfaces for quite a while. On things like steel or plastic hard surfaces, it can last actually a few days. They looked at it on cardboard, which comes up in other areas like delivery. It can actually last up to 1 day. And so it probably has to do with how long the droplet of saliva or whatever can exist without drying out completely on the surface, and other things probably about the surface itself that we may not fully understand yet contribute to how long it can live. So if you look at already the distance the difference between a hard surface and like a cardboard, where something may like dry out faster and get absorbed and diffuse into the material, I would say clothes are probably are obviously more similar to like cardboard because there's like spaces in between the fibers and stuff and more likely to dry out. So I think it's safe to say it can last hours on clothing. So that's why, I think it's important to, if you've been out, take your clothes off and put them somewhere and then wash your hands and take a shower. And, your clothes shouldn't be infectious to you, a day or 3 days later, or however long it is between then and the next time you do the laundry. So it's a relatively short, manageable period of time. But in the short term, like while you have it on, after you've been in public, it's probably likely that something could survive on it.
And that's just a good reminder to wash your masks. I mean, if you have a cloth mask, make sure you're washing your mask regularly too. Not that you're just using it like over and over again. But if you have 1 or 2 of them, switching them out, washing them with your clothes, you can hand wash them in the sink, but just to make sure that you're protect yourself from what could be there.
Well, there's a question for you, Anne. How often should we wash cloth masks?
I think work is recommending that we do it daily. So if you have 2, if you can wash one in the sink one night and then the next day you have a fresh one to wear, that wouldn't be a bad idea.
And one of your colleagues gave a really good example of like what kind of solutions to use and how to wash. And we will probably take a clip out of that that session just for how to wash your mask. So, and she was recommending every day as well. So, and again, to plug that we have masks that we can send folks. So if you want to have 2 masks to rotate in and out, we'd be happy to send you, 1 or 2 masks or whatever it is that you need to stay safer. We are at the top of the hour, so I wanted to give both of you a chance if you want to have a wrap up, brilliant thing to say before we close out tonight. No pressure on that,
That was quite a build up.
I know, sorry.
I think we covered a lot of what people are encountering. So I feel like this is a nice discussion, and I really appreciated the questions. I think we may have additional questions as more people go back to work, and I think there are some specific types of work where people may have other questions, and they can feel free to call in to us and to our warm line, and we can address those. We may have if we decide that there's some demand, we could do some other sessions on specific types of work.
And do you want to add anything before we close?
I just do everything you can to protect yourself and stay safe and wash your hands. Don't touch your face.
Thanks everybody for being here.